How you guys doing?
Doing well.
Alright, so we are students from Delta State University, Abaca. As you can see, you are seeing us on white, right? We are nursing students, final year nursing students from Delta State University, Abaca. And we are sent down to your community to at least carry out some research and as well give heads up to students. You understand me? So I'll leave the floor for my colleague to start off. Thank you very much.
Good morning, everyone.
Good morning,
Good morning, everyone.
Good morning.
How are you all doing this morning? You guys are looking so beautiful. Clap for yourself. Yeah, you guys are actually looking so beautiful. Thank you so much for looking good, looking neat. Everybody's on their socks. Yeah, thank you very much. So today I have a very important socks video. This is a topic that a lot of persons shy away from. Yeah, in your age like this, we tell you something about your body, you just start running, you don't want to hear it. This is something that a lot of persons shy away from. And this is not the time for you to shy away from these topics. So I'll be talking to you about health and hygiene. What did I say?
Health and hygiene.
Health and hygiene. And I'm very sure we have from like DSS 1 to SS3, right?
SS2.
SS2. So just to go to SS2. Every one of you have been exposed to the world outside. Every one of you have been exposed to opposite genders. This is a mixed school. Every one of you have been exposed to things. You have heard things. You have seen some on your phone. You have seen it on TikTok. So I want it to be a very interactive class. So while I'm talking, in case you have some kind of questions, I will be opening some areas for you to ask me questions based off of what you have seen before, or what you have heard before, or what I said to you. So when we talk about health, health is keeping yourself physically, mentally, socially, and emotionally. Everything has to be intact. Health is not just because I know they're sick, because I don't go to the hospital, because I don't go to the clinic, because I don't go to the health center. Your mind has to be healthy. Your stability has to be healthy. You have to think healthy. You have to act healthy. This is the time that you can actually build your self-confidence, because many people, when they are this age, many of them lost their self-confidence. When they talk to them in the street, they'll just be like, what are you saying? They'll just shy away from things like that. But this is the time that you should be able to put yourself out there, be able to speak up for yourself. So when it comes to talking about health, as young girls like this, there are a lot of things that you can do to put yourself on the healthy line of a continuum. When I say continuum, I mean that a balance between what? Illness and disease, illness and health. You see it? Illness is here, health is here. This is me in the middle, I'm the balance. So as you guys are growing up now, you need to make sure that you keep yourself so that you can be in this balance. Leaning towards what? Health, not leaning towards disease. Do you get me? Yes. So we need to lean towards health. And how do we do that? Many of us, we have reproductive systems. Can anybody tell me a reproductive organ in your body? People from the SS2, reproductive organs, what are they? Don't be shy. Don't be shy about it. SS1, reproductive organs. Okay. All right. Reproductive organs are organs that have the ability to do what? To reproduce, right? Organs that have the ability to bring up offspring. Organs that hormones act on. As ladies, as girls, as boys, we all have reproductive organs in our body. Your breast is a reproductive organ. Yes. Your vagina, your uterus, they are reproductive organs. Your testes are reproductive organs. These are things that you are not supposed to be shy about. Yes, it is on you. So how do you keep them clean? Do you get me? How do you keep them clean? Many of us here now, we are at the age of 11, 12. Are they 10 years old here? Even as far as 9 years old, when you see some persons starting their puberty from 9 years old. Puberty is the age between 9 to 13. That is when you see the men, the guys, they start having maybe armpit on their hair, they have a deepening voice. The girls to start having armpit, they start start having coughs. They'll start saying that I don't want to bathe outside again. Oh. Let me go inside the bathroom. Hello. Hi. Are you understanding what I'm saying to you? DJ says one. Are you understanding? Yeah. How old are you? You are 12. You see? So 12 years old, we have 10 years old, 11 years old, 13 years old. These are the age that you are supposed to keep yourself very, very well. What did I say? Keep yourself very, very well, because this is the age that will determine your future. If you are going to go far in life, if you are going to exceed, if you are going to do things at this age, many people are not aware that they are not supposed to do certain things at this age. At this age, as a boy, you notice that you are having hairs on your armpits, you are having deepening voice. Some of them be like, mommy, I don't know why I'm having all these kind of things. I'm having hairs in my pubic area, I'm having hairs in my armpit. Then they will be shy about it. This is not something. These are natural processes. Do you understand me? As ladies, some of them will start seeing their menstrual flow, right? Their cycle will begin. Then some of them will be like, this month I had started seeing blood. When you start noticing things like that, the first person you should go to are your parents. Do not go to the opposite gender and start telling them that this is what I noticed in my body. No. The right appropriate persons you go to are your parents. If you cannot access your parents, you access your teachers. If you cannot access your teachers, the health center is close to you, you access them. Tell them that this is what I'm experiencing. They will educate you how to use a menstrual pad, how to keep yourself. Make sure that even if it's once in a month, the hairs in your armpit, you shave them, because that is what you say, this girl they smell, this boy they smell. You do not want that. You shave your armpits, shave your hairs in your pubic area. You keep your hair clean. You brush your teeth. And this is a very, very key time for you to do what? To abstain. At that time in your life, you don't have any business with any man. Neither do the guys, so you don't have any business with what? Any girl. You don't have business with a boy, you don't have business with a girl. This time for you to build your future, focus on your studies, your education. Look at us now. Tomorrow, some persons will be like us tomorrow. Some persons will be doctors, some persons will be nurses, some persons will be pilots, some persons will even be in the politics. So if you have not gotten yourself pregnant in 13 years old or 18 years old, how will you be able to pursue your career? So as young girls like this, I want to beg you to what? Abstain. To do what? Abstain. When you are coming, you make sure that you have a goal focus in your head, something that you actually want to achieve. And many of us, our healthy lifestyles, there are things that we call healthy living habits. These healthy living habits, are you hearing me? Yes. Healthy living habits, these habits are habits that will help us to stay on the healthier side of the continuum. Can anybody tell me any of the healthy habits? Can you tell me any habit that you feel that if I do this habit, I will be healthy? I want it to be interactive, but you don't understand what I'm saying. You understand? Okay, let me hear you. You said what? Please, let's clap for her. When do we wash our hands? When do we wash our hands? You wash your hands before eating, after eating, after contact. After contact, maybe you and your friend, after you play together with your friend, you guys have touched each other. Before you go inside, do what? Wash your hand. Because that hand already has germs. And many of us are having habits of putting our hands on our face, in our mouth, in our nose. So imagine this hand now that you have used to touch a friend. You have used it to play on the grass, not just because you want to eat that you should wash your hands. Are you there? Imagine this hand now that you have contaminated because you have touched something that is dirty. That is what contamination. Then you put that same hand in your mouth. You are exposing yourself to dysentery. You are exposing yourself to cholera. Do you get me? So when you come in contact with anything or anyone or any object, you do what? You wash your hands. After washing your hand, what are other healthy habits that we should do? Is there another healthy habit? Okay, let me hear you. Bathing. Clap for him. How many times should you bathe in a day? Oh, yeah, Ella, when is the first one? Hello. Yes. So in the morning you wake up in the morning, you do what? You play. Hello. You bathe and you do what? You brush your teeth. These things are helping you to. You are not just bathing for bathing sake. Are you there? Yes. Because there are some boys on Saturday like this, since they are not going to school, they will rather not bathe and wait till evening before they bathe. That bathe that you are bathing, you are reducing exposure to what? Microorganisms. Microorganisms are everywhere. Hello? Can you hear me? Yes, ma'am. Microorganisms are everywhere and you cannot see them. Have they taught you? Yes. You cannot see them. So you don't even know if this place that you are standing on has germs or not. Because you can't see it except you are using a microscope. So now, as you guys are upgrowing, in order to prevent yourself from getting exposed to this microorganism, you do what? You practice personal hygiene. By what? Brushing your teeth, taking your bath, combing your hair, cleaning your body. Do you understand? And your brushing of your teeth should be twice in a day. You brush in the morning and you brush in the night. Before you go to bed, before you eat in the morning, you brush. This ones will help you to reduce cavity. I'm saying all these things because I know that you know them, but you do not know what they do. Brushing your teeth will help to reduce cavity build-up. Cavity build-up are those yellow things that you see on somebody's teeth. Are you there? What do you used to call them? It's called cavity. Cavity build-up. In case you find something like that on somebody's teeth, you tell them that your teeth has what? It has what? Cavity. Say cavity. Cavity. Yes. Then you ask them to do what? Brush their teeth properly. You tell them to brush their teeth properly. And now, when we talk, after talking about personal hygiene, your nails too. Your nails. Do you see my nails? Are they not clear? Why? Are they not clear? You can see the inside of my what? My cuticle. You can see them. If I start checking one by one now, some people will have brown, some people will have green, some people will have black inside their nails. And it is not supposed to be so. So from regular time, you do what? You clean your cuticles. You clean your cuticles, you clean your nail beds. Are you there? Then moving on, we'll talk about how to care for our body, how to care for our nails, then also to our feet. You do the same thing you are doing to your nails, to your feet. You trim them, cut them short. Are you there? Yes. Now let's talk about some sexually transmitted infections that we have. STIs. What's the full meaning of STIs? And can anybody define it for me? Can you define it for me? Hello? STIs, these are infections that you get from sexual contact. At this your age here now, your main purpose of coming to school is to get educated, to attain greater heights. If peradventure you are now involving yourself in things that are not ideal, you are involving yourself with one uncle, or one uncle is telling you that after, as you are coming to school, please branch. Or when you close from school, before you go home, please come and see me. This is not the time for you to do what? Do that. Are you there? So I'll be listing some of these STIs so that we can know and be familiarized with them. First of all, we have staphylococcus. And staphylococcus is an infection that is found everywhere. It's found on the skin. It's found in your genitals. You know what I mean by genitals? Yes. It's found in your genitals. It's found on the skin. It can even be seen roaming around. So to prevent you getting this staphylococcus, you should not engage in any sexual activities with anybody. This is a time for you to do what? To keep your future. This is a time for you to preserve your future. We have gonorrhea, we have candidiasis, we have syphilis. All these infections, we have HIV. And HIV, you know that it's a very deadly disease. You would not want to come in contact with that. In these communities now, if they should do a survey of persons that have HIV, you'll be surprised at the numbers. So this is why you should do what? Keep it. They don't write it on their faces, oh. They will not tell you that they have it. And as girls, some of us might be experiencing one or two symptoms. Symptoms that are not usual. Maybe you sit down. Are you with me? Yeah. The girls, please pay attention. Maybe you sit down and you notice a kind of smell that is not usual. After your period has ended, your period will last for, let's say, maximum of 5 days. Some persons will have it for 3 days. Some persons will have it for 4 days. 3, 4, 5 days after your period has ended, you notice that you are having discharges. You notice that you are having maybe a cheesy discharge. You know what cheese is? You notice that you are cheese, something that is like rough textured, is scattered. All these things, that's why you need to check your body. It's very, very good that you check your body. Notice that you are having a cheesy discharge, or maybe a brown colorist discharge, or yellow colorist, or even green. These are symptoms that are not normal. So if you notice a thing like that, the first thing you should do, because if you are exposed to infection constantly, it can lead to infertility later on in future. And I know many of us want to grow up and have beautiful kids, right? Yes. So imagine you noticing this thing at this age of your life. Some of us might be very shy. You'll be like, I don't know who to talk to. I don't want to now talk. They'll not say that I'm seeing man. You might not be seeing a man and you still have that discharge. I want you to understand that fact. You might still be a virgin. You might not have sexual intercourse with anybody, but you'll be experiencing that green discharge, that yellow one, the one that is discolored, the one that is rough textured. You will be experiencing it. And I know that maybe after now some persons will come and meet me and say that they are experiencing it. If you are that kind of person, please do not be shy. Probably when we are going home, you can walk up to me, or you can walk to the health center. You will find me there. You walk up to them, the clinics there, the nurses there, they will attend to you and they will not segregate you. Don't be shy that somebody will chase you away and say that, wait till make you talk this kind of thing. Or your mommy now, you went to your parents and you told your mom that, mommy, look at what I'm experiencing. They will not chase you. Are you hearing me? They will not beat you. They will not say that you are having something to do with a man. It's not a must that you have. But if you are doing something with a man, it increases your likelihood of getting this infection. And when you are constantly exposed to this infection, you can have what? Infertility. You can have pelvic inflammatory diseases. You can be exposed to HIVs. You can be exposed to cancer. There's a particular cancer now that is outside now. It's called cervical cancer. Have you heard of it?
Yes.
Cervical. Have you been vaccinated?
Yes.
When?
Just one.
They came to your school to vaccinate you. Yes, because that cervical cancer now, it is now on the high side. In Nigeria now, it is increasing. That is why you need to do what? To keep yourself. That's why you need to care for your body. And after you notice all these discharge, you go to the right center. Come to me, come to your teachers, go to your parents. Do not go to the opposite gender. Do not go to a boy and tell them that, look at what I'm saying. No. Do not even go to your fellow friends that are girls, because they don't have the idea of what to do to you. Because some of them might tell you that go and put garlic. Some of them will say go and put this one. Some of them say go and wash this leaf and drink. No. Go to the appropriate authorities. Tell them that this is what you are experiencing. Please, how can this thing be assisted? They will provide you with drugs. They will provide you that, okay, this is what you take, these are antibiotics that you take. And when you are doing that, you take them and you do not want to misuse them. Do not see that because of when I was having this thing that time, this was the drug the woman gave to me. So next time when you start having it again, you now still go back to that same drug. No. You always go and seek what? Medical advice. You seek what? Medical advice. Then when it now comes to you caring for your menstrual health, when your menstruation comes, how many times do you change your pad regularly? Are there still people that still uses clothes or tissue? These are times that you use what? If you are using tissues and you are using clothes, they predispose you to what? More infections. I know that you might have heard that clothes is not good, tissue is not good, but you don't know what harm it is causing. That is what I'm telling you now. It is predisposing you to more infections. It's predisposing your body. Our bodies are open. It predisposes us to infection. So twice, 3 times in a day, 2 times in a day, regularly, depending on how your flow is, you do what? You change your pad. As boys, how many times do you wear your boxers? Am I lying?
Yes.
The ideal thing to do is to wear one boxers per day. So every day you change your boxers. And to see, there's something that we always do. After you wear it, you just keep it. No. You do what? You wash it. Because when you keep it, you are building up bacteria on them. Same thing applies to the girls too. At every interval that you wear your pants or you wear your boxers, you wash it the following morning. And sometimes you can air dry them or you sun them in the sun for sun to what? Heat them. The reason why you are putting it in the sun is so that the sun can take away a lot of microbes on them. So that as I'm telling you, I'm giving you why. I'm not just telling you that do like this and do like this. I'm telling you why, so that it will stick to you. Next time you two can still educate the younger ones that are coming, because tomorrow you two might be someone like me now talking to students in school. When I was in school those years, I used to see people coming to our school. They would come and educate us, come and talk to us. That was where I got the inspiration that I want to become a nurse. I like the way this auntie is talking. I like the way this auntie came to my school. Because of that one, I am aspired, and I will do what? I will start living right into in order to achieve that dream. So as girls and boys, I want to tidy up now. As girls and boys, we should do what? Make our health our utmost priority. Make your health your what? Utmost priority. This is the time for you to abstain. Anything concerning sex, don't be involved. If you have been doing it before, this is a call for repentance. Yes. This is a call for repentance. You do not want to be involved doing that. At least this your community is good. Other communities where I've gone to, I see girls that are supposed to be in SS1, SS2. I see them, so many of them are already pregnant, they're giving birth. But since I came here, I've been walking around, I've not actually seen something like that. I'm feeling like it's if you have a friend that you notice that is doing those kind of movements, hello, hi, I'm typing up. If you have a friend that is doing those kind of movements, please, and tell them that this thing you are doing is bad. If they fail to listen to you, report them. Hello, hi. If you have a friend that is moving wrongly, do you know what I mean by moving wrongly? If you have a friend that is moving wrongly, please report them to your teachers, because they are destroying their future. They are destroying their future. Say no to sex, you guys say yes to your future.